6 foods on your plate right now could be the reason your knees, your hips, and your hands ache more than they used to. Not old injuries. Not just age. Food you eat on an ordinary Tuesday, quietly pouring fuel on the fire inside your joints. And the worst offender of the 6 is one that a lot of so-called healthy products are secretly packed with. I am Dr. Hale. In my 15 years in internal medicine, I have watched people spend a fortune on creams, braces, and supplements for their aching joints, while the thing turning up the pain 3 times a day sat untouched on the dinner table. They never made the connection. Because nobody told them that inflammation, the low, smoldering heat behind so much joint pain, is fed and starved by what is on the fork. Here is why this matters in your 40s and 50s, and not just at 70. Joint pain rarely arrives all at once. It builds. A little stiffness in the morning, a knee that talks to you on the stairs, hands that ache after a day of typing. That slow build is inflammation setting in over years, and the foods we are about to cover either feed it or calm it the whole time. So the choices you make in midlife are quietly deciding how your joints feel a decade from now. In the next few minutes, I am going to count down 6 everyday foods that feed joint pain, from 6 to 1. The food at number 2 wears a health halo that fools almost everybody, and I will pull the mask off it. I am also going to debunk one popular arthritis food myth that has people avoiding a perfectly good vegetable for no good reason. So stay with me for that. First, let me show you what inflammation actually is, because once you picture it, the whole list makes sense. Think of inflammation as your body's fire department. When you cut your finger or fight off a cold, your body sends a controlled flame to the scene, cleans up and puts it out. That is healthy. That is how you heal. The problem is a fire that never gets fully extinguished. A low, constant smolder running in the background, day after day, year after year. The Arthritis Foundation describes this kind of chronic, low-grade inflammation as a driver that can worsen the pain and stiffness of aching joints. And certain foods act like a steady drip of gasoline on that smolder. They do not start the fire, they keep it burning. Number 6 is refined carbohydrates. White bread, white rice, most boxed cereals, crackers, and the pastries by the coffee machine. Here is what they do. The Arthritis Foundation points out that these high glycemic foods spike your blood sugar and fuel the production of something called advanced glycation end products. The name is a mouthful, so picture what it describes. When sugar in your blood runs high, it sticks to proteins the way syrup coats and hardens on a hot pan. That sticky, browned residue gums up your tissues and stirs up inflammation. So a diet built on white flour is a diet that keeps that pan caramelizing all day. The fix is not to fear all bread. It is to trade the refined stuff for real whole grains, which burn slower and spike you less. Number 5 is processed and cured meat. Bacon, hot dogs, sausage, deli slices, the convenient stuff. This one hits your joints from 2 directions at once. First, the Arthritis Foundation notes that processed meats are loaded with sodium and preservatives, and often carry the same advanced glycation end products we just talked about, especially when they are cooked hot and browned. Second, they tend to be high in saturated fat, and Harvard Health flags saturated fat as a promoter of inflammation in the body's fat tissue. 2 inflammatory pushes in one sandwich. You do not have to swear off meat, but the daily deli habit and the weekend mountain of bacon are worth a hard look. Number 4 is fried food swimming in cheap seed oils. The fried basket at the diner, the drive-thru, the chips. Here the issue is a fat called omega-6. Now let me be careful and honest, because this is where a lot of internet advice goes off the rails. Omega-6 is not poison. Your body needs some of it, and Harvard Health is clear that these fats are not the enemy on their own. The trouble is balance. We eat enormous amounts of omega-6 from fried and processed food, and very little of its calming cousin, omega-3, from fish. Picture a seesaw. On one side sits omega-6, which can push toward inflammation when it piles up. On the other sits omega-3, which pulls toward calm. Most modern plates load one end of that seesaw and leave the other empty. Fried food is the heaviest weight on the wrong side. Let me add one more piece to that seesaw because it is the most useful move you can make. You do not fix an unbalanced seesaw only by taking weight off one side. You also add weight to the other. That means eating more omega-3, the calming fat, on purpose. Harvard Health points to fatty fish like salmon, sardines, and mackerel as rich sources, the same omega-3 fats shown to lower two of the body's inflammation signals. So the goal is not to hunt down every trace of omega-6 like it is poison. The goal is to stop drowning in fried food while starving yourself of fish. Tip the seesaw from both ends, and the whole thing settles. Number 3 is alcohol, and beer in particular. I know that one lands hard for some of you, so I will keep it straight. The Arthritis Foundation notes a strong link between alcohol, especially beer, and gout attacks, that searing form of joint pain in the big toe and beyond. When your body breaks down alcohol, it makes more uric acid and clears it more slowly, and uric acid is what crystallizes in a joint and sets off a gout flare. Beyond gout, heavy drinking stokes inflammation across the body more broadly. This is not about never celebrating. It is about noticing whether your flares track with your drinking and being honest with yourself about the pattern. Let me pause right here, because we are halfway through, and the top 2 are the ones that catch people off guard. If this is useful, take 1 second and subscribe to Dr. Hale, and tell me in the comments how old you are and where your joints bother you most: the knees, the hips, the hands. It genuinely shapes what I make next. All right. Number 2 is the one with the health halo, and it is probably in your fridge right now. Number 2 is sugary drinks, including the ones dressed up as healthy. Soda is the obvious villain, and yes, it belongs here. But the sneaky ones are the bottled fruit juices, the sweetened smoothies, the sports drinks, the honey-sweetened iced teas, and the wellness drinks, with a green label and a long list of feel-good words on the front. Here is the mask coming off. The Arthritis Foundation points out that sugar-sweetened drinks, including fruit juice, raise uric acid and are linked to a higher risk of gout, and all that liquid sugar keeps the advanced glycation fire burning. A large juice can carry as much sugar as a can of cola. The green label does not change what the sugar does inside your joints. Liquid sugar is still sugar, no matter how wholesome the bottle looks. And that health halo problem runs deeper, so let me debunk it head-on, because honesty is the whole point of this channel. Walk down any store aisle and you will see products shouting anti-inflammatory on the front, a turmeric latte mix, a wellness cookie, a golden milk powder. Turn many of them over and you find they are loaded with added sugar and sometimes fried in the very oils we just discussed. A turmeric drink with 4 spoons of sugar in it is not fighting your inflammation, it is feeding it, while charging you extra for the privilege. Turmeric and its active piece, curcumin, have some real, modest evidence behind them, and I am not knocking the spice. I am telling you that a health claim on the front of a package is marketing, not medicine, and the ingredient list on the back is where the truth sits. Now the myth I promised to bust. You have probably heard that nightshade vegetables, the tomatoes, peppers, eggplant, and potatoes cause arthritis inflammation and should be avoided. A lot of people cut these healthy vegetables out based on that rumor. Here is the honest picture. The Arthritis Foundation says there is no solid research showing nightshades trigger arthritis flares for most people, and these vegetables are actually rich in the very nutrients that help fight inflammation. A small number of individuals may notice they personally react, and if that is you, fine, adjust. But for the vast majority, throwing out tomatoes and peppers means throwing out some of your best allies. Do not let a myth take good food off your plate. And number one, the biggest driver of them all, added sugar itself. Not just in drinks, but hiding across your whole day, in the pasta sauce, the salad dressing, the flavored yogurt, the granola bar marketed as a health food. The Arthritis Foundation cites research warning that processed sugar triggers the release of messengers called cytokines, which are basically the body's inflammation signals shouting for the fire department when there is no fire to fight. Every hidden spoonful is another small shout, and your body cannot tell the difference between the sugar in a dessert and the sugar smuggled into a savory sauce. It all lands the same way. This is why sugar sits at number one. It is not one food you can simply avoid. It is stitched into hundreds of products, quietly turning up the heat in every joint you have. There is one more reason all of this matters more as the years add up, and it ties the whole list together. Body fat is not a quiet cushion just sitting there. The Arthritis Foundation describes fat tissue as active, capable of pumping out the same inflammatory signals we have been talking about. So the sugary drinks and refined carbs and fried food do double damage. They stoke inflammation directly on the way in, and the extra weight they leave behind becomes its own little inflammation factory. On top of that, every extra pound puts real mechanical load on the knees and hips with every step you take. Feed the fire and add the load, and it is no wonder the joints complain. The good news hidden in that is simple. Trimming even a modest amount of weight eases both the chemical fire and the physical burden at the same time. Let me tell you about a patient. I will call her Diane, and she is a composite of many people I have seen. 57 years old, active, sharp, frustrated. Her hands and knees ached most mornings, and she was sure it was just arthritis and age catching up with her. When we walked through an ordinary day of eating, the picture came into focus. A sweetened coffee drink on the way in, a deli sandwich at lunch, a bottled smoothie she thought of as her healthy afternoon pick-me-up, pasta with a jarred sauce most nights, and a glass or two of wine. She was not eating badly by the standards of most people, but nearly every item on that list sat somewhere on our countdown. She was feeding the fire 6 times a day without knowing it. Now here is the encouraging part, and it is the reason this list is good news, not bad. Inflammation runs in both directions. The same plate that feeds the fire can help starve it. Harvard Health has long pointed to a simple pattern. Olive oil, fatty fish like salmon and sardines, leafy greens, berries, beans, nuts, and whole grains, the core of a Mediterranean-style way of eating, are linked to lower inflammation. You do not swap to a joint-by-joint diet. You swap the worst offenders for a few of these, and the seesaw starts to tip back toward calm. So here is what to do this week. 1. Cut the sugary drinks first, and yes, that includes the healthy-looking juices and smoothies, water, unsweetened tea, or sparkling water instead. That single change removes more hidden sugar than anything else on the list. 2. Read the back of one package a day, just one. Find the added sugar, and start choosing versions with less. 3. Add 1 serving of fatty fish this week, salmon or sardines, to load the calm side of the seesaw. 4. Trade 1 refined grain for a real whole grain, white bread for genuine whole wheat, white rice for brown or barley. Small, boring, repeatable. That is how joint pain gets quieter. Now a clear line before we finish, because this matters. Everything here is education, not medical advice, and it is not a substitute for your own doctor. Food is one dial among many, and it will not cure arthritis or replace a treatment plan. And some joint pain is not about slow inflammation at all. A single joint that becomes hot, red, swollen, and intensely painful within hours can be a gout attack or an infection. and an infected joint is an emergency. A joint that swells after a fall, or pain that comes with fever, needs a doctor promptly, not a change to your grocery list. Know the difference between a slow simmer and a fire alarm. So bring this to your doctor or a dietitian. Ask which changes fit your health, your medications, and your history. Let someone who knows your body help you build the plan, not a label on the front of a box. And here is the thread I want to leave you with. We spent today on the foods that feed the fire, but there is a short list of specific foods that appear, in study after study, to actively calm inflammation and may help your joints feel looser and less stiff, and most people are barely eating any of them. In my next video, I am going to walk you through those, the ones worth adding on purpose, so you know exactly what to reach for. Subscribe so it finds you when it goes up. Whether you are 45 or 75, your joints respond to what you feed them, starting with your very next meal. You are never too early and never too late to turn the heat down. I am Dr. Hale. Take care of yourself.